Ponce, Mariasha Abdul Wahid, Jan Henry Reyes, Faye Tunol, and Patrick June Lawan. The one, two, three, four, five people who are most definitely here. Oh, we have two more people. Eight. Eh, yun. Hi. Morning. So, what do you call this? This is kind of a long and meaty lecture. Yeah, there's a lot of stuff here, but let's try it. Let's not get intimidated by it. I mean, it's too early in the morning to get intimidated. I'm gonna tell you what's important. There are a lot of these things which, there are a lot of things in in the following slides which are, you know, you have to put on in the slides, but they're not really all that important. Okay, so chill lang. As you, just as usual. Oh yeah. Anyway, if any of you have any questions during the course of this lengthy lecture, please don't fret and ask questions. It's fine. Don't worry about it. But try to speak up because I'm going to be going through a lot of um, things in the slide, so I might not be able to see the chat box. Okay. As for your friends who aren't here, ano na. Okay. Before we start, does anyone have any announcements, advertisements? Yeah, check out my vlog, mga ganun. Nothing. No. Happy birthday. Wala. Okay. Great. Ay, sorry. Mm-hmm. Oh yeah, the last song was Sweet Dreams and Seven Nation Army mash up by, oh, I have no idea by whom. Okay. Am I coming across clear?
Yes, Modo.
Okay, great, great, great. Okay. Can you see my slide? Can you see my slide?
Yes, Modo.
What do you see?
Lang.
Okay. Sige. That makes a lot of sense. All right. Okay, now can you see that? Yung parang on, yung parang power button. Great.
Yes, Modo.
Okay. So, so again, good morning, section 1B. B as in bog, right? Yeah. Section 1B. And I'm your host for this morning, Dr. Fritz Tumaneng. And our lecture for this morning is about the,
Backstreet's back, alright.
ayun, mali na agad yung stuff. Anyway, so our lecture for this morning is about the back and the suboccipital regions. I'm your host, Dr. Fritz A. Tumaneng. All right. So before we get into all the scientific medical stuff, let's just make sure we're on the same page here. So where exactly is the back? So let's try to deal with something familiar first. So before talking about the muscles and nerves and whatnot at the back, let's first define what the back is. So last night I had a friend of mine take a picture of my back. So we can see what we're talking about. So this is my back here. That's me. You can tell that that's me. I'm just not facing the camera, but that's my back. Take my word for it. Okay. So the boundaries of my back and even your back are the following. Way on top is the superior nuchal line. On the side of the shoulder is the acromion process. At the midline are my vertebral spines, meaty, and at the bottom part is my iliac crest over there. I have to apologize when they were taking this picture. Because of all the weight I've lost, my pants are a bit loose. So the most inferior part is here, about the sacrum. Sorry about that. So if we connect all of these dots, this is one half of my back. This is the other half. So medically speaking, that's the back. Okay. So theoretically, if we get rid of all my skin from the back, we're going to see this. So what we're going to see under the skin in the subcutaneous tissue is that the back has 31 pairs of subcutaneous nerves yonder. These are actually branches of the posterior rami of spinal nerves. If you don't know what posterior rami of spinal nerves are, well, I'm going to explain what they are later on. Anyway, as you can see, the nerves and the vasculature of the back kinda exit the back at more or less predictable and regular intervals. Okay, we're going to explain the rationale behind this later, but I'm getting ahead of myself. So there are 31 pairs of cutaneous nerves at the back. Eight of them are cervical, 12 are thoracic, five are lumbar, five are sacral, and one coccygeal. Okay, so like I said earlier, the nerves and vessels are arranged in a similar predictable ladder-like fashion in the back. Okay, the back, as we can see here, is covered in deep fascia. So that's this stuff here. All right, but the back also has this special layer of deep fascia. Sorry, yonder. Okay, this one is called your thoracolumbar fascia. So here we have a better picture of it. It's this one. Okay, it's this thick fascia which is actually enveloping the intrinsic muscles of the back. We'll explain later on what these intrinsic muscles are, but suffice to say, the thoracolumbar fascia is a special division of the deep fascia of the back, and it covers everything. It covers the intrinsic back muscles circumferentially. All right. So that's your thoracolumbar fascia over there. It's a specialized thickening of the deep fascia. It's attached medially to the vertebral spines, laterally to the angles of the rib, but more importantly, it wraps around the muscles of the back. So it ensheaths the primary muscles of the back. And to see this thing clearly, let's cut this thing in cross section and zoom in. And okay, your thoracolumbar fascia is thick in your lumbar region. That's how it looks like in cross section. And medially, it splits into three lamellae. Okay, you have this lamellae here, the posterior, the middle, and over here is your anterior lamella. Okay, this thing here, this mass of muscles here, those are your intrinsic muscles. Okay, so as we can see, your posterior and your middle lamellae, they wrap around them, and these are already your vertebral spines here. A vertebra here. So yeah, your thoracolumbar fascia completely covers your intrinsic back muscles. Okay. And this other muscle is your quadratus lumborum. We're not going to talk about that. Okay. Before we talk about the muscles of the back, let's just review briefly where these muscles attach. I'm not going to talk about the vertebral column and whatnot. We're just going to talk about some special points. Okay. These are muscles of the back. So most of them are actually going to attach to your vertebral column and your sacrum. It's kind of obvious. They're the muscles, they're the skeleton of the back. So we're not really going to talk much about these things. Suffice to say, muscles of the back are pretty much going to attach to your spine and your spine. But as for their other attachments, here they are. Okay. So at the skull, let's just review that this one here is your mastoid process, the one behind your ear, bony thing about your ear. On the back of your skull, you have your superior nuchal line. At the center of, below it is your inferior nuchal line. In the middle of your superior nuchal line is your external occipital protuberance. It's that thing here, the back of, you can actually feel it, the back of your head. If you remember when you were kids and you accidentally tripped and your parents would feel the back of your head, this is the one where most parents aren't sure if it's a buccal or it's actually part of your skull. Well, that's your external occipital protuberance. So it's there. As for the ribs, just as a review, this thing here is the tubercle. That's where the transverse process of your vertebrae attached to. And yonder is your angle. That's where the ribs start to become curved. from the back. Key at your scapula. Let's just remind ourselves that this thing here is the scapular spine. The glenoid cavity is the socket for your arm. The acromion is this tip at your shoulder, which is actually the end of your scapular spine. The superior angle is, well, surprise, surprise, it's the superior angle, and the inferior angle is, of course, the inferior angle. Then these ones actually mark the medial side of your scapula. As for the humerus, let's just talk about this one. This is your intertubercular groove. It's there. Okay. As for our hip bones, like I said, the sacrum is going to be a major point of attachment, so it's really pointless saying detailing the sacrum at this point. As for the hip bones, the only thing we have to remember here is the iliac crest, which is that thing over there. All right. So let's now talk about the neurovasculature of the back. So blood reaches your back, your intrinsic back muscles specifically via, sorry, via segmental vessels um, from whatever main arteries there are in that level. Okay, that doesn't make a lot of sense, but suffice to say, that's how it works. For example, here, there's going to be um, a major artery branching off your aorta, for example, and usually these arteries have, sorry, there we go, branches towards the back. So they have segmental spinal branches. This is how it looks like in general. So one more time, this is your aorta. This is a major artery coming out of it, and it's going to have a branch towards the back. Okay. If you multiply this with pretty much your entire vertebral column, what you're going to see is an arrangement like this. So this is your aorta yonder. And there are many vessels at different segments. This is your cervical segment, thoracic segment, lumbar, so on and so forth. And there are blood vessels coming out of here, and they're going to be wrapping around your vertebra to supply the back. Okay. For the cervical area, these main blood vessels, which have branches at the back, are going to be your vertebral artery, your ascending cervical artery lateral to it from the thiocervical trunk, and even more lateral, you have your deep cervical artery from your costocervical trunk. From the thorax, it's a bit more obvious. We have your thoracic, we have your posterior intercostal arteries branching off with spinal segments towards the back. Below the ribs, you have your subcostal artery doing the same thing. At the lumbar area, it's even more obvious. You have your lumbar arteries, giving off arteries to the back. At the sacral area, this isn't that obvious, but you have your lateral sacral artery here. They branch into your anterior sacral foramina to supply the back. Okay, just remember that the back is supplied segmentally. That's the important part there. The venous drainage at the back is more or less straightforward. There are venous plexuses on the outside of the back over here where blood can flow and follow the arteries, or they can also enter the spine with internal plexuses inside the vertebral canal and in front of your vertebral body. Again, okay, it's there. This is the important one. Okay. Like I said earlier, the back is innervated segmentally via the dorsal rami of your spinal nerves. Okay, not sure if you guys have taken this up already in your neuro classes, but this is usually how efferent impulses go. So you have motor impulses coming from your brain, then they go down, 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 down to the anterior column of the gray matter for spinal cord. Then from there, there are going to be motor nerves which synapse there and go out of this one, your anterior root. And here at the back, you have your posterior root. You're going to join at this point at the intervertebral foramina to produce in purple what we call a spinal nerve. You see that, the purple thing, or it's not clear? Clear? Okay, you don't see it.
We can see it.
I can see it. Okay. So, yeah. Okay. So, this thing, the one in purple, is a spinal nerve. Okay. Here's where it gets interesting. Just immediately after it forms into a spinal nerve, your spinal nerve is actually going to branch into two. The branch that we're more familiar with is this one. This is the ventral ramus of your spinal nerve. These are the ones which become your intercostal nerves, and they're the ones which become your brachial plexus, sacral plexus, lumbar plexus, cervical. You get the idea. The things that we spend so much time memorizing. Something that that we spend too much time memorizing. A less popular one is this branch here to the back. This is your dorsal ramus. Your dorsal ramus isn't as exciting as your ventral ramus. It just comes out of there and it goes to the back and it supplies the back. They don't form any plexuses. They don't have any fancy twistings and whatnot. They just go out of your vertebral canal at regular, well, semi-regular intervals, and nothing. They just do their job, and they just supply the back. Okay, so let's make that a bit clearer. So intrinsic back structures are segmentally innervated by the posterior rami of spinal nerves, like I was saying earlier. That's pretty much how they look like. Extrinsic structures of the back and pretty much most of the body, on the other hand, are innervated by the ventral rami of the spinal nerves in red over there. Okay, so there we go. That pretty much explains the segmental nature of the neurovasculature of the back. Okay, now that that's out of the way, let's now familiarize ourselves with the muscles of the back. So this is a kind of sort of diagrammatic representation of the muscles of the back. So the muscles of the back can be divided into two main groups. First are your extrinsic back muscles, which have a superficial layer highlighted right now, and an intermediate layer. Okay. Of course, if they're extrinsic back muscles, there are also intrinsic back muscles, and they comprise the deep layer of muscles of the back. So these are what they are. Okay, the superficial layer, the back yonder, are also called your axio-appendicular muscles. Axio-appendicular because they're muscles which actually begin in your axial skeleton and end up attaching to your appendicular skeleton. Okay, the purpose of these muscles are actually to help move the upper limb or keep them stuck to the body. Okay, so they begin at the back and they end up at upper limb structures and help with the movement of them. Okay, starting from the top, we have the ever popular trapezius muscle highlighted right now. It's called a trapezius muscle because it's shaped like a trapezoid. Well, both sides are shaped like a trapezoid. So it's a large flat muscle originating from your back, somewhere from your cervical region all the way to your thoracic region. Not that important there. The more interesting part about the trapezius is where it attaches distally, and it attaches here. Okay, it's pretty much going to attach in a more or less not blue, in a more or less continuous line from your distal clavicle in your acromion, then it's going to attach to your scapular spine at the back. Yeah. So it's kind of enveloping the shoulder area over there. Okay. So yeah, attaches to your scapula, acromion, and your clavicle. Funny thing is, because of its attachment like that, the trapezius, even though it's just one muscle, has several functions two of which are actually antagonistic to each other. So these muscles here on the top are going to go that way, gonna pull that way, and these muscles here, fibers here, are gonna pull that way. Henceforth, these muscles on these fibers, these superior fibers are gonna end up elevating your scapula, while these ones at the bottom are gonna end up depressing your scapula. Weird, no? So I'm getting ahead of myself. Upper fibers elevate the scapula, middle fibers retract the scapula, and inferior fibers actually depress the scapula. The trapezius is still a superficial muscle, so it's not yet going to be innervated by your dorsal rami-spinal nerves. In fact, it's actually innervated by your spinal accessory nerve, CN11. Okay. Another popular muscle is your lat dorsi. It's this big muscle, pretty much occupying most of your back from the upper middle to the very end of your back. So that's your lat dorsi over there. Proximally, it's attached to mid thoracic level, more or less, all the way to your sacrum and your iliac crest. So it has a large proximal attachment to your back and your hip bones. But look at that. The distal attachment of your lat dorsi is a very small slip of muscle towards your humerus over there. Okay. So your lat dorsi is again kind of super. Oh, so your lat dorsi, this is the one if you guys work out or you like climbing, these are actually what we use for for doing our pull-ups. There's a bar here on top of the screen. You can't see it, so yeah, that's what we use to do our pull-ups. Okay. All right, pull-ups, and for some reason sit-ups also, and well, a lot of arm movements. The lat dorsi is still superficial, so it's going to be innervated by your thoracodorsal nerve rather than your dorsal rami of spinal nerves. Okay. Another muscle at the back, this one is not so popular as your big muscles, is the small levator scapula. It's the one highlighted over there. It's a strap-like muscle connected to your transverse processes of your cervical vertebrae over there, and it attaches to the very tip of the superior angle of your scapula. Okay. So, levator scapula, as the name implies, well, it elevates the scapula. And since it's attached to this angle over there, if this muscle contracts yonder, not only is it going to elevate the scapula, it's actually going to twist the scapula a bit so that it's going to end up looking like this with your glenoid fossa here. And your arms, your humerus is going to droop down over there and like that. So basically your levator scapula elevates the scapula and rotates the glenoid cavity inferiorly in the process. Your levator scapula is innervated by your dorsal scapular nerve, still another branch of your brachial plexus, not yet the dorsal ramus or spinal nerves. Okay, deep to your traps are your rhomboids. Okay, please pay attention to this. Your rhomboids in this area actually look almost identical to another muscle we're going to be talking about later on. I'm going to tell you what the difference is, but just try to remember where your rhomboids are. So these are your rhomboids over there. Like the trapezius, the rhomboids are named because of their shape. In this case, it's a rhombus. It's not a very poetic name, but well, that's what you have. Okay, so it's actually composed of two muscles here. The rhomboid major is that wider, flatter muscle, which is the inferior part of the group. The rhomboid minor is this one here on top. It's thinner. Well, it's narrower, but it's thicker and more powerful than your rhomboid major. Proximally, your rhomboid muscles are attached to your distal cervical muscles and your proximal your distal cervical vertebrae and your proximal thoracic vertebrae. Here's the important part about the rhomboids. The rhomboids actually attach to the medial border of the scapula. Okay, remember your rhomboids are still part of your axioappendicular skeleton. So from the back, they attach to the medial border of the scapula. Okay, please remember that. Okay, because of their attachment in that area, they serve to retract the scapula, and the rhomboid minor also rotates the scapula, the glenoid cavity inferiorly, just like the levator scapula previously. Okay. Now, all of these superficial muscles, because of their configuration, actually form some significant triangles. The more significant triangle in this area is this one here. It's called the triangle of auscultation. It's a muscular gap at your back. It's formed by your trapezius, your lat dorsi, and your scapula. Okay. The thing about this is that in that triangle of auscultation, there's a paucity. Well, what's a nicer word for paucity? Well, there aren't really any major muscle groups or thick muscle groups blocking that area towards your thoracic cavity. So pretty much you can put your your stethoscope in that triangle over there if you want to clear breath sounds from your posterior lungs. Okay, so it's a good place to auscultate your breath sounds. At the lower portion, you have your triangle of Petit. It's that thing over there. It's a muscular gap in the lumbar area formed by your iliac crest, your external oblique, and your lat dorsi. The triangle of Petit is allegedly significant because it is a potential site of lumbar hernia. I have never seen a lumbar hernia, so I don't know how common these things are. Does anybody here have a lumbar hernia? Don't be shy. We're all adults here. See, I have no idea what a lumbar hernia is, but the book says it's there, so we have to talk about it. Okay. Moving on. So deep to your axioappendicular muscles, you have your intermediate layer of muscles over here. Okay. Now, these muscles are maybe accessory respiratory muscles. I'm saying maybe because classically in older editions of anatomy books, these muscles are said to help in forceful inspiration and whatnot. But more recent literature is pretty much saying that, yeah, maybe not. They're just probably there to help to help your body feel out rib movements and how much everything has stretched. I don't know. The verdict is kind of sort of out on is still out on this. The funny thing about these intermediate muscles is that the reason why were initially considered to be accessory respiratory muscles is because they are attached to the ribs. Okay, they originate from your vertebrae, from your vertebral column, and they attach to the ribs. Please take note of that. This is unlike your axioappendicular muscles, which begin at the vertebral elements of the vertebral column and end up attaching to elements of your appendicular skeleton. So these intermediate there's these muscles of the intermediate layer attach to the ribs. Okay. So the first one of this is this one here, your serratus posterior superior, which looks a lot like your rhomboid muscles. That one in blue over there. So these things are deep to the rhomboid. Superiorly, they're of course attached to lower cervical, upper thoracic vertebrae, and they attach to your upper ribs. Okay. When these things contract yonder, so see where they're attached over there, where attached to the ribs over there, they end up moving your rib from this configuration and they pull it upwards into this configuration, thereby expanding your upper ribs. Allegedly. Okay? Maybe. Where is that? Okay. So these things are already rather deep, so they are already innervated by the dorsal rami of your spinal nerves, specifically those of the thoracic region. Lower to your serratus posterior superior is your serratus posterior inferior, another not very poetically named muscle. So this is deep to the lat dorsi. It's attached proximally to lower thoracic upper lumbar vertebrae. Distally, it's attached to your lower ribs. So what happens is if this muscle contracts yonder, your ribs end up rotating from this point and bucket handling down there. So it pretty much moves your ribs down like that. If your serratus posterior inferior, which moves your ribs down like this, works with your serratus posterior superior on top, like that, you end up ballooning your thoracic cage. Theoretically. Okay, like its superior counterpart, this thing is already innervated by the dorsal rami of lower thoracic spinal nerves. Okay. There is a third group to your intermediate back muscles, but actually it's kind of an outcast because it's not positioned in the intermediate layer. It's actually positioned really, really deep over there. Those are your levatores costarum, the ones in blue over there. So there are 12 very small fan-shaped muscles which actually attach to the transverse processes of your thoracic vertebrae and attached in each of these muscles attached to its partner rib. Theoretically, these things are also may also elevate the ribs, but let's be honest, these things are really tiny, so I don't really see these muscles elevating anything. So they're probably proprioceptive to rib movements. Okay, right. Now that we're done with your axiopendicular and your intermediate muscles, we're now going to go to the deep layer of the back. All right, this is actually a misnomer because your deep layer actually has three more layers. So we have your um, superficial deep layer, your intermediate deep layer here, and your deep layer over here. But let's stop calling these things like this. These muscles actually originate at the back at the vertebral column and end up attaching to elements of the vertebral column. Therefore, these muscles are actually the ones responsible for moving your spine itself. Henceforth, these things are already called the intrinsic back muscles. So let's call it that. These are your intrinsic back muscles. These are the ones which your thoracolumbar fascia from the previous slide actually end up enveloping. Okay, the most superficial of the intrinsic back muscles is your splenius. It's way up there. It's actually named from splenion, which apparently is bandage in Latin. Nice to know. But as far as I'm concerned, the thing about the splenius is it actually looks like the cape of those cartoon super villains or something. Yan, like that. It looks like a collar at your back. So you can imagine somebody walking to you with that thing there, and they have this long flowing cape with all of their ha 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 maniacal laughter and whatnot. Or you can also be Doctor Strange and whatnot. Anyway, whatever works for you to remember where this thing is. For me, it looks like the high collars of cartoon villains or whatnot. So that's your splenius. It's there at the back. Whatever works for you and how you'd like to remember it. If you want to remember it as splenion, fine, whatever. It works. Your splenius has actually two parts. Splenius capitis is the more superficial one. Capitis means head. So this one, well, attaches to the head. And your splenius cervicis attaches to the neck. Okay. Proximally, your splenius attaches to the spinous processes of your cervical vertebrae and proximal thoracic vertebrae, and also to the nuchal ligament. Okay, Dr. Ban is probably going to discuss this, but let's get this thing out of the way. This thing here is your nuchal ligament. It's that ligamentous structure extending from your external occipital protuberance, the back of your head, and it actually attaches to the spinous processes of your cervical vertebrae. It's a rather wide ligament at the midline, and it actually serves as a point of attachment also for some of these back muscles. Okay, so that's your nuchal ligament. Distally, your splenius, like I said, this splenius capitis attaches to the mastoid and your superior nuchal line. Your cervicis part of your splenius attaches to transverse processes of some cervical vertebrae. Okay. Um, if your splenius contracts unilaterally, it's going to end up laterally flexing your neck or rotating your neck to the ipsilateral side. If it contracts bilaterally, it's going to end up extending your head and neck. Okay, this is pretty much how most of the back muscles are going to work. Okay, like I said, they originate at the back and they end at the back. So they move the spine and the neck pretty much. Okay, usually if these muscles contract bilaterally, they're going to end up with some kind of extension motion of the back. If the muscles are situated in the lower back, they're going to end up extending the vertebral column. If they're way up at the neck, they're going to end up like extending the neck and the head yonder. If if these muscles contract on one side only, more often than not, they're going to end up either laterally flexing the neck if they're high up or laterally flexing the spine if they're lower down. If they contract, they can also end up rotating the head ipsilaterally if it's situated at the neck, or rotating the spine ipsilaterally if it's much lower. Most of the time, there is going to be an exception, and I'm going to point it out later. Please do not forget the exception. The exception is far more interesting than than the other muscles. Okay, so your splenius is already a deep back muscle, so it's already going to be innervated by the posterior rami of cervical nerves. Okay, so next, let's talk about your erector spinae, probably the most noticeable of your intrinsic back muscles because, darn, look at that. They're huge. They're all the way from the sacrum and they reach all the way to your, well, where's that go? They reach all the way to your mastoid process, actually. So they're very long columns of muscles at the back. So that's your erector spinae. It's the chief extensor of the vertebral column, and it's situated between the spinous processes of your vertebrae and your ribs. Now, as you can pretty much discern from this diagram over here at the right, your erector spinae is actually divided into three columns. You have your iliocostalis at the side, your longissimus in the middle, and your spinalis centrally. Okay. That's, um, these three columns have a common attachment called your erector spinae tendon over there. It pretty much attaches to a lot of stuff over your sacrum and your iliac crest. Okay. Now, depending on where each of these submuscles of your erector spinae are attached, they can also have other names. So, for example, if these things attach to lumbar structures, they're called lumborum. For example, this one highlighted right now is actually your iliocostalis lumborum. If they attach distally to your ribs, they gain a name called costalis. Highlighted here are your iliocostalis, costalis costalis, your longissimus costalis, and your spinalis costalis. If they attach the neck, as highlighted here, they're called cervices, like your longissimus cervices, iliocostalis cervices, spinalis cervices. And if they're attached to your head, they gain a suffix na capitis. Like for example, here, this is your longissimus capitis. Okay, moving along. This is your iliocostalis here, the most lateral member of your erector spinae. Okay. It's going to look complicated, but this is pretty much how these muscles here go. Proximal attachments of your iliocostalis are going to be your transverse processes of lumbar vertebrae and your sacrum. But the thing I'm going to point out is that it actually also attaches here, the iliac crest of your ilium. So henceforth, this is the ilium part of your iliocostalis. So ilio, then it's going to attach to your ribs, costalis. So ilium, the ribs, and then upwards, it's going to attach to transverse processes of higher vertebrae. So from ilium to costal region to transverse processes of higher vertebrae. Okay, so that's pretty much how these things go. So iliocostalis lumborum is that one over there. It kind of begins the transverse processes of lower lumbar vertebrae. Then it ends up going to the ribs. Your costalis portion over here is at the rib area. Already explained that. And your cervicis area actually begins at your ribs and ends up at the transverse processes of some cervical vertebrae. Okay? So, but just remember, ilio to costal to transverse processes of your C4s of your cervical vertebrae. Nothing much to it. Just looks complicated. This one here, it actually even gets even simpler. This is your longissimus over there. So it's the middle column of your erector spinae. Now, generally speaking, looks complex, but this is pretty much how your longissimus muscle works. It's going to begin from transverse processes, okay, of lower vertebrae. Then it's going to go upwards and attach to transverse processes of higher vertebrae, and so on and so forth. So it's pretty much going to be a transverse to transverse muscle, except the top here, because you don't have vertebral transverse processes in your head. Okay, so yeah, transverse processes of lower vertebrae to transverse processes of higher vertebrae. Okay, the thing which I like to point out is this one. Your longissimus capitis begins at the transverse processes of higher vertebrae and ends up at your mastoid process over there. Henceforth, look at that arrangement here. If this thing contracts, it's going to pull your mastoid process this way, and that means your head is going to end up looking this way. Okay, so it's going to twist your head ipsilaterally. Okay, that's not a nice drawing. Let's try to do that again. Okay, it's kind of hard to draw with a mouse. So yeah, it's going to end up rotating your head ipsilaterally. Okay. Moving on, the middle group is your spinalis muscle. The general configuration of your spinalis is that it begins at spinous processes, lower spinous processes, then attaches to higher spinous processes. Again, in this more or less ladder-like configuration. Okay. So it has a thoracic part, spinalis thoracis yonder. It has a cervical part, your spinalis cervicis, higher up there. Okay. So, like I said earlier, if you're these muscles at the back pretty much do more or less the same thing. If your erector spinae contracts unilaterally, they end up either laterally flexing your vertebral column or rotating your spine ipsilaterally as per your longissimus capitis, since it reaches the head, it's going to rotate the head ipsilaterally as well. If these muscles contract bilaterally, they end up extending your spine, your vertebral column. Oh my gosh, that feels good. And as for your longissimus capitis, since it's attached to the head, it's going to end up extending the head as well. Yeah, nothing really much there. Um, yeah, you know what? Before it gets weird, I think I'm gonna have to talk about this. Um, are you guys familiar with eccentric contraction of muscles? I'm going to take that as a no. Okay, so this is usually how muscles work. So, for example, this only one here. We kind of think that your muscles have these set movements. Well, actually, they do. Flexion, extension, and whatnot. All right, but these the muscles, especially the muscles of the back, very rarely move just by themselves. So, if for example you have a muscle which is an extensor and it just moves by itself without moving any other muscles, it's going to end up like this. You know, it's a just one motion like that. However, if you want to do a controlled motion, you actually have to end up using eccentric contraction. What's eccentric contraction? Eccentric contraction is by definition is a muscle contracting antagonistically against another muscle group, um, with a said other muscle group having most of the doing motion. The role of eccentric contraction is to have controlled movements. For example, we're talking about the back. If I just use my erector spinae, if I come just by themselves, I'm going to end up looking like this, military like that. If I want to do this, I'm going to have to end up balancing the extensor muscles with some flexor muscles interacting my movement at the front for smooth motions. To put more eloquently, people who have really poor eccentric muscle control end up moving like this. Parang robot. Okay? Pero if you have eccentric muscle control, you end up moving smoothly. Okay? Because you have multiple groups moving with each other. Have your stick muscles smooth movement of the muscles which are moving, and contralateral muscles trying to counteract the motion of one side, henceforth having smoother movements. Okay, that's what eccentric contraction is. Let's just get that out of the way for now. Later when I go overload. Okay. Once your erector spinae muscles are deep muscles already, they're going to be innervated by the posterior spinal nerves in whatever level they might end up being. Okay. Now now that we're done with the erector spinae, let's talk about this layer of your intrinsic back muscles. These are the transversospinalis group. They're that thing over. So these things actually originate a transverse processes of and attached to the spinous processes of vertebrae. And the reason that they're called the transversus spinalis group is they actually occupy the gutter between the transverse processes of vertebrae and the spinous processes of vertebrae. Or if we look at the section, they're that thing there in purple. Okay. If you're fond of baby ribs, they're those weird things which actually stuck inside the nooks and crannies of baby back ribs. So these are your transversus spinalis group. So it's occupying that gutter over there. Okay. So the most superficial of this group is your seminalis, not to be confused with your spinal previously. Your semispinalis, unlike spinalis, is named as such because it only occupies half of the vertebral column. So not the whole spine, semi-spine lang. So semispinalis. Okay. The actions of the semispinalis, sorry. Your semispinalis, like your erector spinae, are divided into levels. This is highlighted right now. It's your semispinalis thoracis. It has also a cervicis area and a capitis portion. Okay, now this is where it gets weird. Your semispinalis capitis originates at the transverse process of your cervical vertebrae, and distally it attaches to your how do I say this? This area between your superior and inferior nuchal lines. So henceforth, this is this is its origin. That's its insertion, and it pulls your inferior nuchal line that way. So what happens is that from this configuration here, your inferior nuchal line from here, your nuchal lines end up being here. If your nuchal lines end up being there, that means the rest of your head ends up looking there. Henceforth, your semispinalis capitis and mostly the capitis part rotates your head contralaterally. Okay. So, like I said, watch out for the exception. That's the exception. Your semispinal, again, I'm going to repeat that. Your semispinalis capitis and cervix to some point rotates the head contralaterally. The rest of your spinalis, semispinalis muscles help stabilize the spine more or less. Okay, next, deep to your semispinalis is your multifidus. So it's a pretty long muscle. It's actually covered here by the semispinalis. Yun, that's the better picture of multifidus. There are just series of muscles occupying that gutter between your transverse process and your spinous process. And these things actually end up stabilizing the spine. So they're there. So if you have some small movements like that, you've been standing for some time, they're the ones which more or less keep you straight. Okay, and even deeper to those muscles are your rotatores. Let's zoom in a bit. So look at that. Those are tiny little muscles over there. And even if they're tiny little muscles, they actually come in two parts. You have your rotatores brevis, which attach to the transverse process, a lower vertebra, to the spinous process of a vertebra one level above it, and your rotatores longus, which attaches to the transverse process of one vertebra to the spinous process of a vertebra, two vertebra from it. So it skips a level and it's longer than the brevis. Yeah. Actions help stabilize the vertebral column also. And okay, those are your deep muscles, and there are still a few minor back muscles here. Your interspinalis between attached processes together, and you also have your is actually rather nicely. These are your intertransversal. Yeah, I'm almost useless. They attach the transverse process of adjacent vertebrae to. Okay. I think this lecture is going to be asynchronous naman, right? Right?
Yes
Yeah.
po.
Okay. I'm going to go. I'm sorry. Yeah. Okay. Now that we're done with your basic back muscles, we're not yet done. There's still another group. They're called occipital muscles in the suboccipital region. So this is the back of your neck as it looks like with all those intact. Your suboccipital muscles are actually deeper to your trapezius. They're even deeper to your sinus. They're even deeper than your rectus spinae and the transverse spinal group. And that's actually where they are. Really, really deep in the neck. Okay. So these here are actually primarily responsible for these must be much confined to the area underneath your occiput, including C1 and C2 vertebrae. So they're pretty much the ones responsible for your for the movements of your atlanto-occipital and your atlantoaxial joints. So the ones primarily responsible for all of these head movements. Of course, the other back muscles also help with, these things take the brunt of the work. Okay, so the muscles in this area act mainly on your on your craniovertebral joint or your atlanto-occipital joint. These muscles have a special motor innervation. They are innervated by your C1 they're innervated by the suboccipital nerve, which is the dorsal ramus of C1. The suboccipital is the only motor dorsal ramus spinal nerve. Sorry, your suboccipital nerve is the only dorsal rami nerve which is purely motor. There you go. All of the other ones are mixed nerves. Okay. The muscles in this area are a mouthful. They are kind of long. So I don't know how to make these things shorter. If you have a way if you have a mnemonic for these things, please tell me. It's rather confusing. Okay. Having said that, this is first of the group. This one here is rectus capitis posterior major. It attaches from your two spinous process towards your inferior nuchal line. Okay, that configuration. Acting bilaterally, it extends the head. Acting unilaterally, it's going to end up laterally flexing the and yeah, also read ipsilaterally. Next, you have your rectus capitis posterior minor, which is this muscle to the midline. It attaches from the spinous process of C1 to your nuchal line. And this one is basically, well, it just extends the head because it's pretty much close to the midline. That's pretty much all it can do. Towards the sides, you have your obliquus capitis superior. Again, I said it's not named very nicely. It attaches to the transverse process of C1 and attaches the line. Like its partners here, it pretty much extends the neck, he flexes the neck, and also rotates the head. Sorry. Okay, last member of this group is your obliquus capitis inferior, beginning from the spinous process of C2, attaching to the transverse process of C. Okay, note that this muscle is called capitis and obliquus capitis inferior, but it's not attached to the head at all. It's only attached to cervical vertebrae. Okay, but since C1 makes your atlanto-occipital joint and pretty much just rotates the thing here anyway, they just honorary capitis name. Okay. So rotates the head, bends the head, laterally flexes the head. All right. Now, these three of these muscles, your rectus capitis posterior major and your obliquus capitis, form the suboccipital triangle over here. So boundaries are your rectus capitis posterior major and your obliquus capitis muscles towards the side and at the bottom. Okay. The importance of this triangle here are actually what's inside it. Okay. The major components passing through this triangle are number one, your suboccipital nerve over there, which I said earlier was the dorsal ramus of your C1 spinal nerve, the only purely motor dorsal rami spinal nerve in the body. Okay. Another more important thing in this area is this one here. That over there is the end of your vertebral artery. If you don't know this yet, your vertebral artery is actually one of the main arteries which supply the brain. Okay, so your suboccipital triangle is somewhere here. As much as possible, please do not try to poke yourself with sharp objects at your suboccipital triangle because you might end up devascularizing your brain. So don't stab yourself in this area. Having said that though, it's not a good idea to poke yourself with sharp objects in any part of your body anyway. So just don't. Okay. So putting it all together, so like I said earlier, when we're studying muscles, especially the back muscles, we actually assume for simplicity's sake that these muscles work alone. But the truth of the matter is that these muscles actually work in concordance with their opposing muscles and the muscles of the contralateral side to produce your smooth movements, and you don't end up moving like robots. Okay, so suffice to say, when we're standing, most of your back muscles are inactive, but the deep muscles of your back, specifically your transverse spinal group, pretty much help to keep your vertebral column in place and keep you standing erect, especially for long periods of time. Um, your vertebral column, the muscles of the back, actually mostly do extension movements of your vertebral column, such as that. So if they're acting bilaterally, they pretty much do this. And these are the muscles which pretty much do this. But this is nitpicking because pretty much everything does it. For lateral flexion, this usually happens if a unilateral group of your back muscles contracts. These are the ones which do it. But like I said, this is nitpicking because pretty much everyone does it. Again, if you're moving unilaterally, they also produce ipsilateral rotation of the vertebral column in this case. So these are the muscles which do it. But like I said, nitpicking, this is pretty much what happens for pretty much all of your back muscles if they contract unilaterally anyway. As for the neck, if they contract bilaterally, you end up with neck extension motions. These are the muscles that do it. Like I said, pretty much everyone does. Okay. If the neck flexion is mostly caused by muscles of the anterior neck, and the most prominent here is your sternocleidomastoid. Okay, most of the muscles of your neck, if they act unilaterally, well, not most, pretty much all of the muscles of the neck, if they contract unilaterally, produce ipsilateral lateral neck flexion. Nitpicking again. Or they also produce ipsilateral head rotation. Okay, these are the muscles that do it. Except, highlight, underline, bold, whatever. Okay. Except two muscles. Yeah. These are going to be your semispinalis capitis and your sternocleidomastoid. So basically, this one and this one in front. Okay. So one more time, exceptions to the rule are your sternocleidomastoid and your semispinalis capitis, maybe some of the cervices also. I'm not sure I had another slide to wrap everything up, but I think that was my last slide. Questions? Anything? Overwhelmed? Shocked? Yes, you are shocked. Okay. I'm going to upload these slides